Hello, my name is Dan Other, and I'm pleased to be presenting this paper on behalf of myself and my co-author, Sarah Other. Today, we're going to be talking about sustainable development in the Anthropocene, how it requires interprofessional environmental health as science diplomacy. We're going to cover the abstract of our article, as well as the various sections from introduction to conclusion, including introducing science diplomacy, as well as how nursing and environmental engineering contribute to meeting the United Nations Sustainable Development Goals. In our abstract, we noted that the Anthropocene is a current geological age where human activity is the dominant influence on the environment. It creates a global challenge to achieving the United Nations Sustainable Development Goals. The purpose of our article is to raise awareness that the current dire situation facing the unlikely success of the SDGs is not dissimilar from the situation that faced the unlikely success of the MDGs. And we encourage the full range of professionals who operate as humanitarian technologists, including nurses and engineers, to recall two things. First, the axioms of Florence Nightingale's environmental theory, that man's natural state is healthy, and that the humanitarian technologist's chief job is to modify the environment to restore health, and also to adopt a holistic lens to solve crises of disaster, recovery, and sustainable development. This builds on our prior definition of humanitarian technologist. The United Nations Millennium Development Goals were to reduce by half the number of people living in poverty by 2015. In 2007 and 2008, a global recession, shocks in food prices, and the Arab Spring all contributed to disruption in the MDGs. Nonetheless, the world rallied, and by 2015, many of the MDGs were accomplished. Between 2015 and 2030, the SDGs are linking the developing world and the developed world. Similar to the MDGs, the world experienced a shutdown with COVID-19, a slowdown in the economy. There's war. All of these threaten the attainment of the SDGs. In 2015, the world achieved the MDGs in part because they relied upon historical precedent, the Great Sanitary Awakening in London in the mid-19th century. We're going to learn from nurses now to accomplish our work today. What is science diplomacy? To accomplish the SDGs by 2030, humanitarian technologists need to implement science in diplomacy, diplomacy for science, and science for diplomacy. One way to do this is to collaborate with nurses. Nurses have identified a model of how to achieve sustainable development. Nurses focus on something called the social determinants of health: economics, education, access to healthcare, community-built environment, and planetary considerations. As shown in Figure 1, nurses center people. Planetary health wraps around, or accompanies, or supports people. This people-first view of nursing fits very much with the ideas of science diplomacy, advocating for people. But nursing has actually come forward with some new proposals. As nurses on this pale blue dot, the impending climate crisis requires us to engage with our world and communities different if we hope to ensure planetary survival, human and non. Imagine the next 50 years of nursing theory, we advance a post-human critique of the discipline. We urge nurses to critically engage with the realities and shape our present and future on a deteriorating planet. Nurses have noted that we live in the Anthropocene, a time when human activity is the dominant geologic force. Part of that is the Capitalocene, where the search for wealth causes humans to perceive the environment as a source of wealth, as opposed to part of a natural system. Ultimately, upstream policies, midstream activities, and downstream technologies are the ways both engineers and nurses engage with the public, engage with the planet. And nursing is arguing that engineers need to consider the upstream policies associated with planetary health, in addition to meeting the needs of individual people. We, of course, know this in the field of environmental engineering. We know that achieving the SDGs requires humanitarian technologists to recognize a transition away from reactive systems while adopting a precautionary approach, to recognize the historical improvements in human health and life expectancy have been unequally realized and at the expense of deteriorating natural systems, thereby jeopardizing the well-being of present and future generations. We often describe sustainable development using Figure 2, this Venn diagram. as though planet, people, and prosperity exist separately, and sustainable development is found at the intersection. Of course, the problem here is that people can exist in a non-sustainable manner. We imagine the planet deteriorating as we extract from it, and we can think about an overemphasis on prosperity. There are alternative ways of conceptualizing sustainable development, and this will influence the way we interact with technology. We can imagine a system that centers prosperity, wraps around this people and planet. We can imagine a system that creates a hierarchy of planetary resources at the base, upon which a healthy population lives, through which humanity can thrive. Conceptual frameworks are important for us understanding how we interact with technology as humanitarian technologists. In our discussion, we highlight that sustainable development includes meeting the needs of the present without compromising the ability of future generations to meet their own needs. The MDGs emphasize basic physiological needs. The SDGs emphasize increasingly complex material, including financial security, the ability to meet physiological needs in the aftermath of a disaster. But in this people-first lens of sustainable development, we're encouraging humanitarian technologists to retain nursing's person-centered approach, to recognize the value of the individual, but also to adopt a holistic lens, employing the concepts of environmental engineering, recognizing that caring for the public must include caring for the planet as well. In conclusion, the aim of this article was to raise awareness that the challenges facing multilateral diplomacy, including science diplomacy, to achieve the SDGs between 2023 and 2030 are not dissimilar from the challenges that were overcome to achieve the Millennium Development Goals. Through a presentation of an ad hoc selection of the literature in our paper, we strongly urge humanitarian technologists to avoid exclusive people-first lens and instead adopt a holistic approach that decenters the worst of human traits from the Anthropocene and considers a quintuple bottom line of people, prosperity, and the planet, along with partnerships and peace. Thanks so much for your attention. Sarah and I are very happy to be here with you at the Global Humanitarian Technology Conference. We wish all of you lots of learning. Thank you.